Hey, Dr. Vicky here. So I want to talk about a patient that came in last week with a movement disorder. Difficult case. Both sides are moving. One side was oscillating a lot faster than the other. And that tells me that it was probably a wind-up condition. And so that was what I was leading. That was what was leading in my mind the problem. And so I had to figure out what activities would slow down that wind up. And so when the brain winds up, it's like it's over. It's working harder, and it doesn't have any inhibitory factors that are limiting what's happening. So we had to try to bring the other side of the brain up so the one side isn't so dominant on the right side. So the right side has a map for the right and left side. So we've got this situation where I would have him visualize certain things with his eyes closed. Oscillations on the left side completely stopped. So I was trying some different things to see what would work, because the same treatment for one person is not going to work for the other person. And so when you're looking at this, you've got to figure out what is going to work for this particular person. So what do? You try stuff and you see what happens. And I have watched his autonomic nervous system, and because he has a tendency to accelerate his pulse. And so I know when it's too much and we have to stop that treatment. So that's how I worked with this individual. So, and what do you do if the treatment works? Well, you test it and retest it. So you give them an opportunity to do maybe some of that at home on a regular basis. And if they're willing to do that, and at some point you have to retest that. So every time he comes in, I'm going to retest that to make sure that it's still working, because sometimes you have to switch gears. So that's not uncommon as far as, especially something that's been neurologically damaged for a long time, and you see the situation kind of do well for a while, and then you have to figure out the next thing. So it doesn't work for everybody. But if you have a difficult condition and nothing has helped in the past, give Souter Chiropractic a call at 303-385-3432, or you can reach me on my website, souterchiropractic.com.